Thank you, sir. And at the onset, I would like to thank the All India Scientific Committee and the Chief Instructor for giving me the opportunity to present a very interesting part of ERG. Just now, Dr. Vibhuti sir explained about the basics of the ERG and why it is required in our retinal diagnostics. My job is to let you understand what are the requirements for doing an ERG. So basically, the machines and the electrodes. So to record an ARG, two things have to be understood: the basic technology and the clinical protocol associated with it. The basic technology includes electrodes, stimulation of light, and the electronic recording device. The clinical protocol understands the preparation of the patient, the ASCEF standard ERG, and the analysis and the reporting of the ERG. Now, coming to the first part, those are the electrodes. Basically, there are three types of electrode required for recording ERG. They are the active electrode, reference electrode, and the ground electrodes. The electrode stability is maintained by a very good connection as it decreases impedance, and more impedance would mean more noise, and that would lead to wrong reading. Electrodes need to be kept clean to avoid infection and also for its reusability. It's also important to note that cleanliness decreases the impedance. For a good recording by an active electrode, one has to ensure the use of non-irritating, non-allergic, ionic, conductive, and a relatively non-viscous solution, a good ocular contact to ensure proper electrode impedance, and we should define both the normal values and variability for our own laboratory. Now, active electrodes basically can be of conductive fibers, foils, conjunctival loop electrodes, and contact lens electrodes. These contact lens electrodes are centrally transparent with an optical opening, just works like a lid speculum, gives the best recording, and the recording is stable even with higher amplitude. Now, the different types of electrodes are skin electrodes, which are mainly used in children, corneal ERG electrode, monopolar, those are jet contact lens electrode, and the bipolar, that was the Burian electrodes. Then we have got the DTL electrodes. This is one of the most commonly used electrodes in the ERG. Finally, the gold foil electrodes. We'll be discussing this at our later stage. Then, after active electrode, we have got reference electrode. They are incorporated into the contact lens speculum assembly when one uses bipolar electrode like Burian or electrodes for stable configuration electrically. Now, electrodes can be placed near orbital rim or earlobe or forehead. The third type of electrodes are the ground electrodes, where a separate skin electrode is attached to an indifferent point and connected to the ground. The typical location for placement of the ground electrodes are forehead or ears. Now, what is actual electrical impulse that the ERG calculates? Now, it is the impulse that is captured by the active electrode, which has got two things. First is the potential changes and the impedance, and the reference electrode, which captures the impedance only. Now, subtracting this, that is E minus R, actually gives us the actual electrical impulse. Now, coming to the individual electrodes, the first is the jet electrodes. These are disposable monopolar contact lens electrodes, gold foil electrodes, or polymethacrate with lead wire. Ease of insertion is there. Movement of lens during recording in absence of lid speculum contribute to its variability of the recording. It reduced possibility of eye infection, but the only disadvantage is the gold plating itches off with time. Then the other commonly used electrodes are the Burian Allen electrodes. These are bipolar reusable contact lens electrode with built-in lead speculum with a lead wire. They are customizable to various sizes, ideal for infants. The reference electrodes are built into the electrodes, which are conducting coating of silver granules. PMA shows variable degree of blurring, so not suitable for recording pattern ERG where the image clarity is vital. They are generally used in full-field ERG, but the only drawback is it's very costly. Then the DTL plus are the microconductive thread electrodes. These are the most commonly used electrodes. They are conductive threads 50 microns and float on the corneal film surface. It has a negligible mass, low cost, and disposable. It's convenient to use and gives a very clear image. No interference with pupil or optics, as we can see in the picture. It gives a very reliable ERG reading, and they are well tolerated by children. Then we have got the gold foil electrodes. They are useful when you cannot use a contact lens electrode or when you don't want to anesthetize the cornea. The ERG amplitude will be substantially affected by this electrode, and it requires an adapter. So the color coding for different electrodes include the active electrodes are red in color, the reference electrodes are blue in color, and the ground electrodes are black in color. In the preparation side, the skin has to be cleaned properly for the reference and the ground electrode, and for that purpose, we can use skin prep gels as a new prep gel. Now, cup of the electrodes are filled with gel and are attached for better conductivity. These are the channel which connects the active reference and the ground electrode. There are two types of channel. There are channel 1 and channel 2. Now, test for one channel, then we use a one eye, then we use a one channel, and if we are testing for two eyes, we usually have got the two channel adapters. Then comes the second part. Those are the machine. Now, what are the different machines that different part of the machine that we use for recording ERG? We have got a computer monitor which tells us at what stage the investigations are going to go on, and then we have got the part where the stimulation actually is seen by the patient. Now, this then again has got two kind of monitors. One which gives us a pattern stimulation, and a Ganzenfeld valve which gives us a flash stimulation. Now, this is a side view to show how the electrodes are placed. Now, in a multifocal ERG, one eye is closed, and this is how we keep the electrode and patch the eye. There is a movable chin rest which has to be placed in front of the monitor. This is a picture which demonstrates the ERG getting along, where the chin rest with monitor and the fixation point can be seen. The monitor displays the random pattern of multifocal ERG. Then, after that, completion of the test, the chin rest is removed and the Ganzenfeld ball is comes into the action. Now, this is a closer view of baby flash for babies and unconscious patient. This is what Ganzenfeld ball gives a closer view. The movable child rest has attached in the other place when the test is finished. This is a picture that shows different electrodes put in the different places in the different tests. So, recording the ERG, the test procedure is explained to the patient. Pupils are fully dilated, size of the pupil are recorded. The patient is dark adapted in a dark room with an eye patch, electrode attached with a dim light in the room, and we start the test. Attach the electrode and follow the guidance coming on the computer screen. Now, there are some safety informations that have to be kept in mind, such as the printer and the external USB hard drive should be connected via Wi-Fi, and if disconnected, should not be tried to connect while the test is being performed. The automatic windows of the system should be deactivated. The dark room should be kept properly dark. Disconnect the power supply before any cleaning or repair, and there should not be use of an extension cord. To use an external, it's always good to use an external drive to have a regular backup, and a password should always be used to protect the patient's data. For the patients, electrodes should never be used in the damaged skin. The patient should be thoroughly explained about the procedure, and all the doubts have to be cleared, and the waste should be disposed in the household waste. Thank you very much, sir.
Thank you, Dr. Rahul. We really appreciate your presentation because it really explains us the different kind of machines. So you talked about the Ganzenfeld bowl, where you get the flash stimulation. The other is screen, where you get the stimulation by the screen, and flashlight for the babies. Very nice. So do we have any question? If not, then